Hi, my name is Bree Cowart, and this is my presentation on motivational interviewing. So the history of motivational interviewing. This was founded by William Miller and Stephen Rolnick, and a good quote that kind of describes motivational interviewing is, the more you try to insert information and advice into others, the more they tend to back off and resist. So what is motivational interviewing? Motivational interviewing is a directive, client-centered counseling style for eliciting behavior change by helping clients to explore and resolve ambivalence. Compared with non-directive counseling, it is more focused and goal-directed and departs from traditional Rogerian client-centered therapy through the use of direction, in which therapists attempt to influence clients to consider making changes rather than engaging in non-directive therapeutic exploration. The spirit of motivational interviewing is collaborative, it's evocative, and it's honoring of patient autonomy. The four guiding principles include resisting the writing reflex, which means we should resist giving suggestions to our patients for their problems. You want to understand and explore the patient's own motivations. This means understanding the patient's motivations by being a curious listener and attempting to elicit the patient's underlying motivation for change. You want to listen for empathy, and as far as with listening, you want to be patient-centered and have an empathetic approach. You also want to empower the patient. They need to understand that they are in control of their actions, and any change they desire will require them to make steps towards that change. So you may be thinking, what is the goal for motivational interviewing? The goal involves coming alongside the person and helping them to say why and how they might change for themselves. It involves adopting the familiar style of a guide rather than a fixer, and helps the practitioner to aim for more of a satisfying, time-efficient, and effective consultation. So ambivalence is natural. There's something in human nature that resists being coerced and told what to do. As a child, as a teenager, I'm sure when you were younger, you didn't really want to do what people, especially your parents, wanted you to do. So it is kind of like a natural thing to have this type of ambivalence. Ironically, it is acknowledging their freedom to choose and not change that sometimes makes change possible. So what are the core skills of motivational interviewing? They are being open questions to explore concerns and promote collaboration and understand the client's perspective. Affirmations to support strengths and convey respect. R is for reflective listening to explore deeper, convey understanding, deflect discord, and elicit change talk. And summarize to organize discussion, clarify motivation, provide contrast, focus the session, and highlight change talk. So what are some examples of open-ended questions? They would be like these. What would you like to talk about? How did this problem start? What would you change if you could? How do your actions relate to your problem? Some affirmation examples include, I appreciate your honesty. I can see you care. It shows commitment that you have good ideas. Examples of reflective listening include, you are saying, so I'm hearing, and what you mean is. 3 communication styles include being direct, following, and guiding the conversation. 3 skills include asking, listening, and informing. And to summarize, you want to communicate that you understand the situation. So this can be at the end. Some examples include, stay focused on important issues. You can emphasize certain elements, and let me see if I understand. So the 4 processes of motivational interviewing include engaging, which is building an alliance and working relationship with your client, focusing, coming to a shared idea about the main focus, evoking, bringing out the client's own arguments for change, and planning. The client is willing to envision change and how they go about making it. So what approach have I used in practicum? So one of the approaches that I have used is elicit, provide, and elicit. An example can include, how do you feel about the medicines that you're taking? And they would say, I take them when I feel like I need them. And then I would provide, actually, it is important to take your medicines every day, even when you feel good, for them to work effectively. The patient would say, I didn't know that. And then you would say, what is going to be the best way for you to do that? And then that would kind of give the patient, well, I guess I can start taking them before I go to bed. And that's showing that they can think of ways to help their situation. So here an example of what can be used to help initiate change talk. It's called a motivation ruler. So what the patient does is list whether they're ready for change. 1 being that they have no motivation at all to initiate change, and 10 means that they're completely ready for that change to occur. So they'll go through and they'll pick out the number. After their client responds, even if their number is low, you can ask, why isn't it lower? Why did you choose a 4 instead of a 1? Having the client verbalize why they have some motivation for change rather than none at all would lead them to speak in favor of making that change. As a follow-up question, you can ask, how can we move from a 4 to a 6 on the ruler? And this can help. So when you start hearing change talk, how do you respond? So first you want to elaborate on the details. So, okay, well, now we're ready for change. What are some things that we're going to do to make sure that this change occurs? Let's write it down, as far as your goals to get to that change. Affirm the change talk through reinforcement and encouragement. Yay, I'm excited. They just started talking about changing. You want to be excited for them. Reflect what the person is saying and summarize that at the end. So motivational interviewing has been very effective. There is a large body of research supports that motivational interviewing is an effective evidence-based practice. One research study was a meta-analysis of 115 studies, and in the results it showed that motivational interviewing was effective for 75% of all participants, significantly effective overall compared to no treatment, and as effective as other evidence-based treatments for substance use disorder. Motivational interviewing is ideal for all populations regardless of gender, age, and problem severity, and showed us the greatest impact in minority populations when compared to other common substance abuse disorder treatments. Motivational interviewing can increase client engagement up to 15% and increase treatment retention when given an intake assessment. And one thing that motivational interviewing does not work best on is for very young children and cognitively impaired individuals because of the necessary higher order mental functioning demands. It's harder for them to process, or maybe they're not able to process because of their cognitive deficits. Here are my resources, and you have a great day.